The largest measles outbreak in 25 years,
leading to new concerns about a lack of vaccinations.
This is a public health crisis.
Anti-vaccination messaging has had a resurgence in recent years, despite extensive evidence disproving links to health issues such as autism. Hundreds of cases of measles have been reported across at least 23 states in 2019, the largest outbreak since well before 2000, when the disease was considered eliminated in the United States. Misinformation surrounding the safety of vaccines is not new, but the current spread has been driven in large part by social media. Private and public Facebook groups share images and videos of children with disturbing health issues allegedly caused by vaccines. Some of these groups have more than 100,000 members. This story about triplets who purportedly developed autism just hours after being vaccinated was posted in the Vaccine Injury Stories group on Facebook, which has more than 28,000 members. The CDC says there's no link between vaccines and autism, and a massive body of research supports this position. On Instagram, anti-vaccine users post memes demonizing mandatory vaccinations and supporting the right for parents to choose whether or not to vaccinate their kids. And when you type vaccines in Instagram's search field, top results show accounts that promote anti-vaccine content. When you search for vaccines on YouTube, the platform's algorithm curates videos from official sources like the CDC and hospitals. However, loopholes in the system suggest content that promotes false information on vaccines, and the platform suggests videos in the Up Next column that can feature misleading material.
Social media it's relatively easy to manipulate and to use to influence people, especially when they are vulnerable because they are looking for information and they're concerned about their children.
Framing of the anti-vaccine message has evolved too.
There are people and actors on social media that have a product to sell. It may be their book, it may be what they tout as an alternative to vaccines. One of the changes that we've begun to note is, more of a framing of the issue as vaccine choice. The parents should be able to make a decision about whether they get their children vaccinated. The challenge with that and what we're seeing is while the framing of it is vaccine choice, much of the content remains the same.
Social media organizations claim they are addressing the problem. Instagram has pledged to block anti-vaccine hashtags. Facebook announced it would stop suggesting users join pages and groups that feature anti-vaccine material. YouTube said it would not allow users to make money through ads on anti-vaccine videos. Health organizations are taking on the misinformation, using pro-vaccine campaigns in the social space. And early research indicates they may be having some impact.
Our recent results that are still preliminary because we're still analyzing them, we haven't published them yet, but they suggest that there has been a consistent large cluster or group of accounts that spread a lot of misinformation about vaccines. In the last couple of years, we seem to see a shift where this cluster of accounts that are mostly spreading misinformation is shrinking somewhat, and they seem to interact more or be more influenced by sources of reliable information.
Despite these encouraging findings and the commitments from social platforms, misinformation on vaccines continues to proliferate online.
I think it undermines trust in research, trust in science, and trust in government agencies that are charged with protecting the public's health. That's a dangerous and slippery slope.